My name is Jamie Pyner, and I'm the Director of Social Services here at Heritage Hall, King George. I've been here at Heritage Hall, King George since November of last year. However, I've been with American Healthcare for about 5 years now. What makes King George facility unique is, I think, the small proximity of our building, our staffing, our connection to the community. It's a very small, close-knit community. I think that makes it very, very unique. We don't get lost in the shuffle when it comes to King George. They knew who we are, what services we provide. A lot of our staff are invested in the community. They have been with this company for many years. They live here, and I think that shows a sense of pride and dedication. My daily routine here at Heritage Hall is not really routine. Every day is different. Dealing with almost 100 patients gives me 100 different mornings or possibilities every morning when I walk into the door. But mostly as a social worker, my goal is to make sure that residents are happy and that they're getting appropriate care. On our skilled unit, however, it's more dealing with discharge planning, ensuring that things are being followed through with insurance protocols, with referrals, home health, meeting with families and making sure that we have a safe discharge. A lot of our patients on the rehab unit come from being at home, interacting with family members, email, phone calls, and when they come here, they're kind of left to their own devices for hours on end before families can come in and visit, after work hours. And so during the day, they just want companionship. When it comes to our long-term side, it's just, they want to share their stories. They just want somebody to talk to. And so, the most important thing that I do is, again, just give them, my ear for a few minutes. And sometimes that's all that you need to do, is just sit down for a couple minutes and listen to them. My favorite part of the job is getting to know different people here in the community. They come from vast experiences. Being that we're close to Richmond and DC area, we have a lot of former military personnel, so I love hearing their experiences, their travels, listening to their spouses, and stories about how things used to be here in King George when it was nothing but farmland, and now it's kind of slowly developing. So really just getting to know the residents on a personal level is my favorite. I would encourage them to bring their family members here for services because of our staff who provide that one-on-one care. They're very open to getting to know the residents' likes and dislikes. I can tell you there's not a morning that doesn't go by which we have staff members, personally deliver newspapers and bring a cup of coffee because that's what they're used to, and it just makes their morning start on a happy note. It's the little things that our staff members do for the residents that goes a long way, and I think it's because we are so close-knit. We're not a huge building with a lot of staff, and you kind of get lost in the shuffle, I think that definitely plays through to our residents and our rehab patients.